Friday to you. It is July 26th, and you are listening to the Friday Five here on the Agent Survival Guide podcast. I'm your host, Sarah Ruppel, and today we are focusing in on one topic, bringing you 5 things about the Medicare Prescription Payment Plan. Last week, the Centers for Medicare and Medicaid Services published the final Part 2 guidance for the Medicare Prescription Payment Plan. We've been following along with this legislation for quite some time now. The first part of the draft guidance was released in August 2023. The second part of the draft guidance came out in February 2024. We got the first part of the final guidance in March 2024, and on July 16th, CMS published the second part of the final guidance in advance of the 2025 AEP. Now that we have both parts of the final guidance, it seemed like a good time to pull that information together into one episode to highlight the important takeaways for agents. So that is what we're going to do here today. First and foremost, let's put some context around the Medicare Prescription Payment Plan. The program was brought into existence by the Inflation Reduction Act and aims to help Medicare Part D beneficiaries spread their costs out over the course of a plan year, rather than paying for costly medications upfront in one big lump sum. CMS has been very clear from the outset that this payment plan is not a way for Part D beneficiaries to save money on their drugs. Definitely important to remember that as you're talking with clients and leads. Now that we've got that working definition, let's move on to number 2. Who can enroll in the Medicare Prescription Payment Plan? All Medicare Part D beneficiaries are eligible to enroll in the program, including those who are enrolled in a low-income subsidy, or LIS for short, and often referred to as extra help. CMS recommends running clients through both of these programs at the same time, so you can check to see if they qualify for extra help and also let them know about the repayment plan. Couple other things agents should be aware of. CMS is asking Part D plan sponsors to look at their enrollment data and determine which enrollees reached or exceeded $2,000 in prescription cost between January 1st and September 30th. That $2,000 number comes from the Part D out-of-pocket max for coverage year 2025. Plans will be required to reach out to enrollees that met or exceeded that threshold, letting them know about the Medicare Prescription Payment Plan. If that's the case for your client, when you're talking through prescriptions and getting health information, you definitely want to mention the program. Another threshold to watch for, and this was another number set by CMS in the Part 1 final guidance, a point of service prescription with a cost that met or exceeded $600. Defining a dollar amount was important because, according to CMS, quote, this approach identifies Part D enrollees with a very high likelihood of benefiting from the Medicare Prescription Payment Plan program, while reducing the risk of identifying Part D enrollees for whom the program may not be as helpful, end quote. In their most recent Part 2 final guidance, CMS reiterated the importance of the program, identifying, quote, Part D enrollees who face high cost sharing earlier in the plan year are more likely to benefit from the program, end quote. So those are 3 things that you can look out for as you're talking to Part D enrollees or potential Part D enrollees during this enrollment period. Out-of-pocket costs in excess of $2,000 between January 1st and September 30th, a single point of service prescription cost in excess of $600, and high cost sharing early in the plan year. Moving on to number 3, when can beneficiaries enroll and when does the new program become available? Beneficiaries will be able to opt into the program during this coming AEP, so beginning on October 15th, 2024, and then any time after that. Enrollment is not limited to the annual enrollment period, the open enrollment period, or any special enrollment periods. The idea is for enrollment in the Medicare Prescription Payment Plan to be available anytime a beneficiary might need to opt into it. The program goes into effect for enrolled beneficiaries when the 2025 coverage year begins on January 1, 2025. Some other timeframes to consider. Prior to the plan year beginning, Part D sponsors will have 10 calendar days to process the request to enroll a beneficiary into the Medicare Prescription Payment Plan. And then during the plan year, Part D sponsors must complete program enrollment requests within 24 hours. Part D sponsors must send program election request forms to beneficiaries either in the same mailing as their membership ID card or in another separate piece of mail sent at the same time as their ID card. Fourth thing that we want to mention here today, very important for both you and beneficiaries to know. For beneficiaries enrolled in the Medicare Prescription Payment Plan, how they pay for their Medicare Part D drugs will change. Rather than paying for their prescriptions at the pharmacy, what we call point of service, or POS for short, beneficiaries will submit payment to the Part D plan sponsor. Very important for beneficiaries to understand they will not be asked to pay anything when they receive the prescription at the pharmacy, but they will get a bill for that cost-sharing amount from their Medicare Part D plan sponsor. Another quick thing I want to mention before we move on to the next item on the list. Beneficiaries do have the ability to opt out of the program if they so choose. And beneficiaries, again, don't have to wait for a specific time period. They can opt out at any point in time during the plan year that they choose. When they opt out of the program, they will not get a bill asking for the full amount of what they currently owe to their Medicare Part D plan sponsor. They will be able to continue making monthly payments until their balance is paid down, and then any new out-of-pocket costs will be paid at the point of service at the pharmacy. If a beneficiary wants to opt out of the program and would like to pay their full balance as a lump sum, they will have the ability to do that if they like, but it is not a requirement. The entire point of the program is to remove the potential friction of financial hardship that sometimes makes beneficiaries choose to not fill doctor-recommended prescription drugs. The fifth and final thing I want to mention here today, education. CMS plans to release educational resources for beneficiaries around the Medicare Prescription Payment Plan. In the fact sheet for their Part 2 final guidance, CMS specifically mentioned that Medicare.gov will have materials and resources, quote, including a cost preview feature in the Medicare Plan Finder and a fact sheet, end quote. CMS will also include information in this year's edition of the Medicare and You Handbook, and they're holding training workshops about the program in the summer, as well as what they call a, quote, more robust training in late September, end quote. We've included information in this episode that we think agents should know, so you'll be able to answer client questions. As we mentioned in the beginning of the episode, these changes are just one part of larger changes coming to Medicare because of the Inflation Reduction Act. There's a lot of new information to be aware of, a lot of new information to present to clients and potential beneficiaries as you're walking them through the process this AEP. Thankfully, we've got 2 resources to help agents as you're putting together your plan presentations, swapping out last year's information for all of the new updates from CMS for AEP 2025. We've got an informational leave behind flyer that outlines all the important changes for clients, including a reminder to keep an eye out for that annual notice of change letter. We've also created a presentation that covers the changes, not just from the Medicare Part D Prescription Payment Plan, but all of the changes coming to Medicare Part D in 2025 because of the Inflation Reduction Act. That presentation highlights the benefits for clients and what they can watch out for in that ANOC letter. And then best of all, both of these downloads are able to be customized with your name, phone number, license number, and your email or website. The 2025 IRA Changes presentation and flyer can be downloaded in Marketing Center, which is a part of Integrity's Medicare Center. If you're already registered with Ritter Insurance Marketing or any of the Integrity partners and you have a Medicare Center login, you'll be able to log in and download that resource. If you do not yet have a Medicare Center account, we would love to chat with you about how to get started and get set up so you can take advantage of this resource and all of the other amazing resources available for agents partnered with Integrity. Couple of ways you can reach out to our team. You can reach out to our sales team. We'll have their contact info in the episode notes. If you want to send us an email, you can do that at asgpodcast@ritterim.com. And if you'd rather give us a call, you can leave a voicemail at 1-717-562-7211. Just be sure to let us know your name and the state you're working in, and then we can get you matched up with the appropriate person to have that conversation. There are a lot of changes happening this year on the Medicare front. We would love to be able to help you through those changes so you can in turn help your clients with those changes this AEP. That's all we've got for this week's episode. Thank you so much for listening. I hope you have a great weekend. Stay healthy and stay safe out there. And we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an Integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Tina Lamoureux. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with us wherever you like to listen.